Hello guys, and welcome to the second video. If you didn't see the part 1 video, I hope you can see the video which will appear on the right. This video will continue the dural venous sinuses, which are venous structures that drains the inside of the venous blood of the inside of the cranium cavity or inside of the brain and parts of the central nervous system. Now, we explained the singular veins, which were located at the midline. Now we'll go to the paired veins, which are located on the right and on the left sides. We have right and left versions of these next sinuses. Namely, we have the transverse sinus, we have the sigmoid sinus, we have the cavernous sinus, and we have the superior and the inferior petrosal sinuses. Now I'll go through each one, and as you know, we'll go through the location, the termination after saying the origin, and the course, and the tributaries, and any other important landmarks. The first sinus, as you know, is the transverse sinus. Now, you remember from the last video that the superior sagittal sinus end up on the right as the right transverse sinus, most commonly, not always, but most commonly, and the straight sinus, which have come from the joining of the, if we have here, this is the inferior sagittal sinus, and this is the great cerebral veins. They will join, forming this straight sinus, which move like this straight ahead and join deviate to the left more commonly. So this one here is inside and it deviate to the left. This is the origin of the left transverse sinus. Now, what is the location of the transverse sinus? The transverse sinus runs along the margins here of the occipital bone, and it terminates at the end here, and it descends downward, forming the sigmoid sinuses that I'll explain in a few minutes. Now, what is the course? Each one of these right and left occupies the attached border of the tentorium cerebri. They originate here at the internal occipital protuberance, which is a very important landmark, and here the confluence of sinuses, and they move like this. If we have a pen here, for example, it will move like this, and on the right and on the left, and they will they will form a groove within the occipital bone and the inferior posterior part of the parietal bone here. This groove is known as the transverse groove, as you can see here also. This is the transverse groove for the transverse sinuses, as you can see in this picture. This is for the transverse sinus course. Now, going to the tributaries of the transverse sinus. The transverse sinus drains superior petrosal sinuses, which I'll explain at the end, inshallah, the last vein. And we have also cerebellar veins, which drains the cerebellum. And we have inferior cerebral veins, some of which in the medial side drains into the midline one, the singular vein, inferior sagittal vein, which is located here inside, and the remaining inferior from this side drains into the transverse sinus. We also have diploic veins, and that's it for the tributaries of the transverse sinus. Now, this image is a great image that show you how the transverse sinus comes from the confluence of sinuses, and it descends in this course, and then it descends downward, forming this here. This is new venous sinus that I'll explain now, which is known as the sigmoid sinus. Now, the sigmoid, it has a sigmoid shape, as you can see clearly from the picture, and the name implicates how the structure of the venous sinus is. The sigmoid sinus. Now, this sinus is originate direct continuation of the transverse sinus, and the course, it runs downward and medially. It passes medially here. Now, this image can show how it descends medially. It goes like this, and this image also show it how it goes medially and downward at the beginning. And here at this part, it passes in the temporal bone. This is the temporal bone. Okay, this is an internal view of the temporal bone. We have this part here, which is known as the this is the mastoid part of the temporal bone, and this groove is very clearly that it is for a sinus. Now this sinus grooves into this bone as it start developing during intrauterine life and form this groove here, which is known as a groove for the sigmoid sinus. Now after it passes here, as I said, it descends downward and medially, and then it passes forward and inferiorly, joining the superior jugular pulp, which is the termination of the venous structures of the brain into this superior sagittal jugular pulp, which continue as the internal jugular vein. Now this is for the for the sigmoid sinus. Next sinus is a very important sinus known as the cavernous sinus. Now you may have heard of this sinus very importantly. It is one of the venous structures that in the relation of the pituitary gland, the master of glands, a very important structure, and it passes also through this venous sinus. There is 1,000 different large number of structures that passes through this cavernous sinus. So let's know about the sinus. First, the location. It is related to the middle cranial fossa. This is the anterior cranial fossa. This is the anterior cranial fossa. This one in red is the middle cranial fossa, which is our interest right now. And this one here is the posterior cranial fossa. Now it is located in the red part, in the middle cranial fossa, specifically here at this area. Okay, so this cavernous sinus, it's located on each side of the body of the sphenoid bone. Now this is here, this is all the margins of the sphenoid bone. You can see this is the sphenoid bone, okay, very clearly, and here this is the body of the sphenoid bone. So it is located at the sides, right and left of the sphenoid body. And now it extends anteriorly from the superior orbital fissure and till the back, which till the apex of the petrous part of the temporal bone. So here we have this is the temporal bone. This is the temporal bone, and this is the petrous part of the temporal bone. This is the apex of the petrous part of the temporal bone. So it is located, it extends from the superior orbital fissure into the apex of the petrous part of temporal bone. And now what is this venous structure? Why it's so important? And how come there's other structures that passes through this venous structures that's supposed to have blood? And how it is like very large like this in this shape? These are important questions, are described from the name. The name is cavernous sinus. If you know what is the meaning of cavernous, it's from cavity. Now cavity, means that it have there are walls that are interconnected, forming a spongy appearance. It have a spongy appearance, and there are many structures that passes through this, as you can see here. And this spongy appearance is very important character of this cavernous sinus and very unique character from all the other dural venous sinuses. What are the structures that passes through the cavernous sinus, as you can see here? So this is a cross section through this part. You can see this is the internal carotid artery, how it passes and pins forward inside this cavernous sinus, and then it ascends upwards. Now, the cavernous sinus have important structures. First, we have this internal carotid artery, as I said, and this also part of the internal carotid artery. This is a superior view of a cut section. This is a coronal view of the from backward. So this is here. If you have this is superior and this is inferior. Okay, so here we have this is the right cerebral hemisphere and this is the left cerebral hemisphere. Now what are the structures that pass through the cavernous sinus? First one is the internal carotid artery with those small black dots, which are the sympathetic sheath of this artery, which control its diameter. We also have just adjacent to this one is the abducent nerve, which is the cranial nerve number 6. And we have also a bunch of nerves that run on this side, which namely we have the oculomotor or third cranial nerve, the fourth cranial nerve or trochlear nerve, the ophthalmic, and the maxillary divisions of the trigeminal nerve or cranial nerve 5. Now the lower or the mandibular division of the trigeminal nerve doesn't cross through the cavernous sinus. How these structures pass through here? We have a lining endothelium here that prevent the contact of the blood with these structures. Tributaries, what drains into these venous structure? We have first is the sphenoparatile sinus. Now this sinus here clearly is known as the sphenoparatile sinus, and it drains directly into the cavernous sinus. The next we have the central retinal vein, which passes here, draining the blood from the retina, and it passes within the optic nerve, and it actually drains, as you can see here, from this part into the cavernous sinus. We have important venous structures that have a clinical value actually, which are the superior ophthalmic vein and the inferior ophthalmic vein, both of which drains into the cavernous sinus. Now, why are they so important? Because infections that may come from the face, for example, you have an acne on your face, and this acne get infected, and this infections may be drained actually by venous structures, and this infection may lead into the cranial cavity through the cavernous sinus. So this part here is actually dangerous, and this venous drainage is important clinically. We also have some other tributaries for this cavernous sinus, which are the inferior cerebral veins, draining the inferior part of the cerebrum, of the cerebral hemispheres, drains into the cavernous sinus. Now, what are the drainage of the cavernous sinus? Where does the blood after going into the cavernous sinus go? So this deoxygenated blood will go into the either one of 3 roads, 1, 2, and this is the third road. The first road is the superior petrosal sinus, which you remember it's one of the tributaries of the transverse sinus, and it drains to it. And we also have the second road, which is the inferior petrosal sinus, which also drains into the jugular vein, internal jugular vein. And we have the other road, which drains into the pterygoid plexus. Actually, you can see this is a plexus here, and it's named as pterygoid plexus. Now, finally, we have important part for this one. It's unique for this dural venous structure. This character is the presence of communication, a direct continuation between the right version and the left version of this cavernous sinus or of this venous sinus. So you can't see this directly in any other parts, except if you can for the confluence of sinuses, but here directly the blood from the right cavernous sinus flow into the left cavernous sinus and vice versa. Okay, this interconnection is known as the intercavernous sinus. Between the cavernous sinus, we have an anterior branch and a posterior branch, and both of these branches both of the anterior and the posterior intercavernous sinuses are anterior to and posterior to the infundibulum of the pituitary gland, and they lie over the diaphragm cilia, which it's a part of the dural folds. Now that's it for the cavernous sinus. Going to the last venous structures that I'll explain today, which are the superior petrosal and the inferior petrosal sinuses. This is the superior petrosal, which already mentioned 2 times, one with the tributaries of the transverse sinus and one from the drainage of the cavernous sinus. So now you know the origin, and now you know the termination, and the course is actually from the name. It is just superior to the petrosal bone, petrous bone, and this is got the name because they run superior to and inferior to the petrous part of the temporal bone, which I already explained before here. This is the petrous bone, so they run superior to and inferior to the petrous part of temporal bone. Now these sinuses are, just as I said, we have the origin and we have the termination, which already discussed many times. Now you might get lost, okay, but this venous structure are important to drain the venous blood and the cerebral spinal fluid from the brain and ultimately ending into the internal jugular vein. We have the superior cerebral vein, the great cerebral vein, and the vein of the medial aspect of the hemisphere. The veins of the medial aspect drain into the inferior sagittal vein and also into the superior sagittal vein, which the superior sagittal vein also drains into the confluence of sinuses, and the inferior sagittal vein joins with the great cerebral vein, forming the straight sinus, which also drains into the confluence of sinuses. Now, the middle cerebral veins, which are from the inside sometimes, and the inferior cerebral veins drain into the cavernous sinus, which drains via the inferior petrosal and the superior petrosal into the sigmoid, or specifically into the transverse or sigmoid. It doesn't matter very importantly, but ultimately the transverse sinus will continue as the sigmoid sinus and will finally become the internal jugular vein at here the jugular notch from the jugular foramina, from the cranial cavity, and descend downward into the right atrium to be pumped via the heart into the lungs to be oxygenated again. Thank you for listening and see you in another video.